All right, it's confident.
Tony?
All right, hi Joe.
Hey.
How's it going?
Good. How are you?
Good. My name is Andrew. I'll be your PT today. Let's see here. So it looks like looking over the sheet here, coming in for some upper left trap, some tightness there. So before we kind of begin with our examinations and everything, I'd like to ask a couple questions and just get to know you a little bit better, and maybe some reasonings for what brought you in to get some PT done. So
Sure.
To start off, just tell me about the injury. How did it occur?
It's more of just kind of like a recurring pain. Like I worked for a boxing gym like a year and a half ago, and I found that when I'm boxing and stuff, my upper trap just gets really tight. So I'm just kind of looking to see what I can do to relieve that.
Yeah, sure. I'm going to be taking some notes throughout this, but please ask any questions that you may have or anything as we go.
Okay.
So tell me exactly, do you know when this injury first started?
Honestly, I'm not entirely sure. I'd say I worked for a boxing gym for almost a year, and I'd say maybe a few months in, I started really feeling it, and it hasn't really gone away since.
Okay. So it was it's been more of a chronic condition?
Yeah.
Okay. And then with the mechanism of injury, or like kind of what do you think is kind of causing the pain? Is it a specific motion or?
Yeah, I find it mostly gets tight with like punching motion. So like when my hand's coming forward here, I think just a little bit of elevation there's, I don't know, there's some kind of tightness that's being irritated.
Okay, so you're saying like punching is what's kind of causing the pain the most?
For sure.
Okay. Well, perfect. So with your boxing, were you a competitor at all?
No, just mostly training.
Just some training?
Yeah,
Okay.
yeah. I used to be a trainer at the gym, so
Oh, really?
doing the workout or showing people the workouts, and then I'd also do the workouts. So.
Oh, nice. Sounds like you are really into boxing.
Not as much anymore since I don't work there anymore, but it was fun while I was there.
Yeah, absolutely. So since you're not boxing anymore, are you still staying active? What are you doing?
Yeah, so the building I live at actually has some heavy bags, so I still like box maybe once or twice a week.
Okay.
And it hasn't been as bad lately, but I haven't been as consistent with boxing either.
Mm-hmm.
So I usually do that. That usually is a cardio thing once or twice a week, and then lifting a few times a week.
Okay. So it sounds like overall pretty active.
Yeah.
So between lifting and cardio, you're also doing a little bit of boxing just on the side?
Yeah, and that usually takes up one of my cardio days most of the time. So I'll be doing some kind of cardio. It's either boxing or biking or running, stair climb, something like that.
Okay, cool. So what else are you doing when you're not doing that? Like kind of like what's the average day look like? Are you working, a student?
I'm a student, so it's mostly just sitting through lectures, doing some labs, taking notes on the computer. So pretty sedentary during the day, and then just trying to work out after class is done.
Yeah, absolutely. I definitely understand that. So perfect. Let's talk about your trap a little bit more, just to get a better idea of what's going on. So you're saying that from kind of keeping the arm up, kind of getting some tightness there.
Yeah.
Punching is kind of aggravating it.
Mm-hmm.
So is there anything that you do that you've noticed that kind of helps relieve the pain?
I used to stretch a lot more, and that would help. I had somebody that I used to work with that would do some trigger point release for it, and that helps probably the most out of anything. But I haven't had anybody to do that for me for however long. So.
Okay. Well, how come that stopped?
Just because I moved. So I used to work there and I moved. So.
Okay. How long ago did you move here?
I moved here beginning of fall last year.
Beginning of fall.
Yeah.
Okay.
For school.
For school.
Mm-hmm.
Gotcha. Nice. What kind of school?
I'm going for physical therapy actually. So.
Nice. Very good.
Yeah.
Well, perfect. If you have any questions, don't hesitate to ask.
Okay.
Okay, so stretching helps. Trigger points helps the most.
Mm-hmm.
Sounds like. Okay. You tried any therapy in the past for this at all?
No, this is the first time I'm addressing it.
Okay. What made you wait so long to come and kind of get it checked out?
It's just been kind of irritating lately, so I figured rather than trying to cope with it, I'd try and do something about it, because it doesn't seem like that major of a thing, but I'd rather take care of it than not be annoying, you know?
Yeah, absolutely. Yeah, it's definitely good to kind of bite these things early and don't let them turn into something bigger. So,
Right.
well, perfect. So yeah, we could definitely add some stretching and trigger points that maybe into our therapy and see if those can't help as well, and then maybe add some like strengthening or something that we could also do, and maybe just try some different things, and we'll hopefully get some good results.
Okay.
So looking over the intake form that we had you fill out, symptoms are irritation and tightness, and so other than that, have you been experiencing any lightheadedness, dizziness? Okay. Any unexpected weight loss or gain? Okay. Have you been falling or anything like that?
No.
Okay. How are you sleeping? Are you sleeping through the night? Is this causing you to wake up? Anything like that?
No, it's really, I think just the activity kind of makes it flare up, so sleeping's been fine.
Okay. Well, that's good. Excellent. Let's see here. What do we want to talk about next? Have you been taking any medications for this? Any pain medicine?
No, I don't really. Yeah, I haven't really. It hasn't been enough pain to really feel like to solicit taking medication for. So
Sure. Okay. And you were referred by Dr. Bon Wu. So did he have any imagings or anything taken?
no, not at all.
No. Okay. Perfect. And then. So, with that, without any information there, and it looks like overall you're really healthy. Didn't check yes to any of these down here, but is there any family history that may run in the family of any of these diseases?
My grandma has arthritis, but it hasn't, like, none of her direct descendants have it. I don't have it that I know of. I'm sure there's some people that have high blood pressure in my family, but I feel like that's pretty common. Other than that, I think it's fine. My mom has exercise-induced asthma, but I don't, so I think we're clear on most of those.
Okay, good. Sounds like pretty good genetics. So then, so you're a student, pretty sedentary during the day, but you're active kind of once you're out of class. Okay, good. So with that, have you found that the tightness in your trap, has it led to any issues with your just daily living?
Not really. I only find that, like, it gets irritated with actual exercise of it.
Okay. And with exercise, is that also referring to lifting?
I actually haven't had too much trouble with it lifting. Like, I still do shoulder shrugs, and like I do some sunrises with weights to activate the traps, and that actually doesn't irritate that much.
Okay.
But I feel like it's more like an overuse type of thing, where like with boxing you're punching a lot, so it's usually like midway through the workout all of a sudden it like tightens up. So like I'm not doing enough reps strengthening it where it get irritated.
Okay. Yeah. So it sounds like it's kind of fine throughout the day, except specifically with boxing.
Right.
That's when you feel it the most. Okay. How far into like a boxing workout before you start to kind of feel it?
I'd say probably halfway through, and then it starts kind of tightening up.
Okay. How long is a training session usually?
Usually a little over half an hour, maybe half an hour to 45 minutes.
Okay, so somewhere on the 15-20 minute mark.
Yeah.
You kind of start to feel it.
I'd say that's pretty accurate.
How would you rate that pain at when it starts to kind of feel it around there?
I'd say probably just like a 1 or 2. It's not really like painful, as more as like irritating. Like I find myself shaking it out a lot to try and keep it loose, or like I have to stop punching because it tightens up too much. It's just kind of a tightness pain.
Yeah. When you're kind of shaking it out, do you try to stretch it yourself at all, or?
Yeah, I'm usually like trying to bring it down and bring my neck over, try and loosen it up and stretch it out during, but you can only do so much during the workout.
Yeah, absolutely. Okay, good. So is there any other pain that this may have led to, like anything down the arm or maybe in the neck at all?
No, I don't think so.
Okay, and then, well, that's good to know. As long as things aren't getting worse, that's always a good sign. So overall health status, seems like you were pretty active outside of being a student, so kind of that mix of kind of sitting down a lot during the day and then being active at night. When you're early in the morning, do you notice it at all when you're getting ready for the day or anything?
No, not at all.
Okay.
Even during the day, it's really not that bad. Like, I mean, sitting here thinking of it consciously, like I can tell it's tighter compared to my other side,
Mhm.
but it's not painful at all.
Okay, good. So no pain at rest.
No, not at all.
Okay, that's good. Okay. Is there any other issues that you would like for me to just know about at all?
I don't think there's anything else. It's mostly just the trap tightness.
Okay, perfect. Well, let's go ahead and set a couple goals for therapy. Tell me something that maybe you like to maybe set a goal around. It could be anything, boxing or lifting or anything like that.
I think it'd just be nice to kind of get back to boxing without having to worry about it, or like if it honestly, if it just wouldn't tighten up, you know, if I could just get through a training session without it being tight, would be nice.
And how long is a session?
About half an hour-ish.
Okay, yeah, you said that. So, boxing session about 30-45 minutes without worrying about pain or tightness.
Right.
Okay. Good. And then what's another goal that we could set for you in terms of this? Maybe adding a specific stretching routine to your daily?
Yeah, that'd be nice. I've been pretty inconsistent with stretching it, so implementing something like that would be great.
Yeah, so we'll stretch daily with your schedule as a student, do you think 5 to 10 minutes maybe?
Yeah, that'd be totally fine. I could make time for that before bed or something.
Okay. Yeah, I think that could maybe be a good place to start, even outside of therapy, maybe.
Mm-hmm. Yeah, I like
work
that
on that a little bit.
Yeah.
Okay, so just to do a quick review of things, it looks like some upper trap tightness on that left side, been a chronic issue.
Mm-hmm.
Looks like it doesn't bother you throughout the day, except you notice it quite a bit when you're punching and boxing.
Mm-hmm.
Other than that, it's a 1 out of 2 pain at most, but a 0 at rest.
Mm-hmm.
Okay. Looks like you're lifting and doing cardio multiple times a week, and that doesn't give you any problems. So that's all good to see. No major medical history or past medical history, and it looks like otherwise really good health. So yeah, I think a couple of good goals would to get you through a boxing session worth 30-45 minutes without any pain or tightness occurring.
Mm-hmm.
And then really setting a goal to stretch daily for 5 to 10 minutes and see if that doesn't help with the symptoms at all.
Yeah,
and
that sounds good.
We'll go on and we'll move into the physical examination, just kind of double check things and see how things are firing and whatnot.
Okay.
And we'll continue from there.
Okay, cool.
All right. See you in a little bit.
All right, thank you.